Welcome back. We have Dr. Preety Desai joining us today, laser implant specialist. Great to have you back on the show.
Thank you, Susan.
We're talking today about an epidemic almost of some people's standards, and that is diabetes. The number of people that are being diagnosed with this every year is increasing exponentially in North America, and it's a huge problem. Our diet has a huge part to do with it, and we're now learning that there's a huge connection between diabetes and what's going on in your teeth.
That's right, that's right. About 9% of Canadians have diabetes, and you are 4 times more likely to have gum disease if you are a diabetic. And you are 2 times more likely to lose all your teeth because you're a diabetic as well.
What is the connection there?
The connection is twofold. One is that with diabetes, we know that when we eat sugars and foods, we can't digest them properly. The insulin is either inefficient or not active enough, and then your blood sugar goes up. What happens then is that the bacteria in the mouth use that sugar to become steroid-induced bacteria and cause worse infection. And the corollary is that if you're having some gum disease, the amount of inflammation in the body actually affects the insulin backwards, and then the insulin doesn't work as well. So it's like two-way street, unfortunately.
So the better condition your dental health is,
yes.
the better chance is it the better chance you have of developing diabetes or not developing it, or taking control of it if you already have it?
Much better control over it.
Okay.
Diabetes, of course, has its own causes.
Yes.
Independent to the gum disease causes. But when they have sources that are in common, it's like an explosion that happens.
Do you see this in your practice?
All the time, and
really?
More so, I've actually diagnosed diabetes from the mouth and asked them to see their physician.
Really?
Yeah, and the photos today that we'll present will show that as well.
9% of Canadians have diabetes. I wonder what percentage of that knows or doesn't know.
Well, it says probably in the literature that it's about 20% underdiagnosed.
Is that right?
So we have symptoms of thirst, immediate weight loss, dryness of the mouth, frequent urination. Those are all typical diabetic signs and symptoms. But then when you have a silent oral killer like periodontal disease, it's 2 silent diseases in one.
Wow. We have some pictures that you sent in today. Perhaps we could take a look at those.
Yeah, so the first one is just basically red gums. Even though aesthetically you wouldn't see to the untrained eye that something is unusual here, the redness of the gums and the little puffiness of those little triangles between the gums, the papilla, it's a dead giveaway. This is the first diagnosis and look of early diabetes in the mouth.
Really? And
yeah.
What, if it's not too technical, what does that mean? What's going on with the red?
That's inflammation. That's infection.
Okay.
Yeah, silent and painless. So it doesn't look so bad, and yet occasionally it'll bleed when the person brushes.
Okay, let's take a look at the next picture here.
So this is kind of the third step of diabetes, that you can get that inflammation. The redness is there, as you can see, but those little triangles are puffier and kind of, sorry to gross you out at lunch, puffier and larger. And because that person isn't taking care of their teeth because it's sore and painful, you start getting cavities, and that's the brown spots on the teeth as well.
Okay. Are there more pictures? I think there might be a few more. Here we go. Here's one.
And yeah, and it's just another in the progression of this is just getting worse and worse, that you see the gums receding now and more wiggliness of the teeth. So this person could actually probably not function very well eating an apple or corn on the cob, for that matter.
What do you recommend for people? Oh, there's another picture. Let's take a look at these.
Yeah, and this is, again, the final of tooth loss, things just kind of flying in the wind, and it's basically the last stage of it.
Okay, and I think one more picture after this one.
And yeah, just exactly the same. It's just getting worse and worse, where you get plaque buildup, teeth wiggling, gums that are receding fully, and spaces between the teeth.
Once the damage is done, how far back can you take it? How much can you prevent or reverse some of this?
Well, at that point, that last picture we saw nothing, unfortunately.
No, but when the gums are red like that, that's the warning sign.
That's right, and that's reversible, completely reversible with good treatment, analysis of how to treat properly, and patient education.
Okay, fantastic. Is there anything else you want to add about this connection between good dental health and diabetes?
Well, November is Diabetes Month, and I feel that the awareness of the patient needs to be proactive, and that's why I wanted to show the photos to say, if you look like this or if you're worried, go talk to your dentist.
Absolutely.
It's really easy, and doctors may not be as easy to get into today in Kamloops, but dentists are easy.
Yeah, you know what?
And we
Very
can
good.
direct you properly.
All right, Dr.
Yeah.
Desai, we always appreciate having you on. Thank you very much.
A pleasure. Thank you,
All right,
Susan.
you're very welcome. KamloopsPeriodontist.com is where you can go to find out more information. We are back in 2 minutes. Stay with us.